All right, everyone, welcome back to the Black Carnivore podcast. And today I have a really exciting guest that I can't wait to introduce you to. So we have Dr. Phil Ovadia, who is a cardiologist and carnivore who lost 100 pounds. And we're going to hear his story today. And then I'm going to ask all of the cardiology questions that you guys ask me all the time. So you can hear it from an experienced person who is both experienced in the carnivore diet and, of course, as a cardiologist. So without further ado, let's dive right in. So why don't you tell me your story? I mean, I heard that you said you had lost 100 pounds. So how did you do that? Was it all carnivore, some part of it? How did you even decide to try carnivore?
Sure thing. Just to step back, I am a cardiothoracic surgeon, a heart surgeon, and I found myself about 10 years into my career, about 40 years old. I had always been obese my entire life. I was an overweight child, despite being very active as a child, despite eating, what was pretty much in line with the typical recommendations. I actually have a brother who's a type 1 diabetic, so we never really had sugar in the house, and everything was kind of low fat and supposed to be healthy for us. But despite that, I was obese through my childhood, and then it continued through college and medical school and the early part of my career. And I found myself 40 years old, operating on patients who were getting closer in age to me, I would say, or I guess I was getting closer in age to them. And I saw that, many of them were obese. I discovered that I was pre-diabetic. But, I had tried to lose weight many times in my life. I had lost weight many times in my life, but was never able to keep it off, and it would always come back and more. It's a struggle that I know many people relate to. And, honestly, my life changed. It was January 26, 2016, and I was at a medical conference for heart surgeons, and there happened to be a guest speaker that day by the name of Gary Taubes. And I'm sure many in your audience are familiar with him. He had just released his book, The Case Against Sugar, and he gave a talk about how, obesity wasn't caused by eating too many calories necessarily. It was related to the types of food that we were eating. And it was really the first time I had heard that messaging, because, as a doctor, as a physician, as we go through school and everything, the teaching is always, you just eat more than you burn, and that's why we get obese. And Gary's message, really kind of struck a nerve with me, and I read his books, and I started down my sort of low carbohydrate, low sugar journey. And over the intervening couple of years, I kind of went through, what I would say is a pretty typical evolution, where I was doing, low carb and then really doing keto, and did pretty well, lost, I would say, most of the weight that way, and was feeling pretty good. And then one day, as I learned more and more, I got more and more curious, and I was listening to podcasts, and I was reading all the books, and I was reading the scientific literature about all this. And one day I came across a podcast with a guy named Sean Baker, and Sean started talking about the carnivore diet. And as, again, I'm sure your audience knows, Sean's an orthopedic surgeon, and he was very convincing. But I also said, that's a little crazy. You can't live without vegetables, and you can't live without fiber, and all the things that I had been told my whole life. But, I started to think, because at that point I was on a very low carb ketogenic diet. I was probably eating under 20 grams of carbs a day. And I said, these little bit of vegetables that I'm eating really, do they really matter that much? And maybe he's right. I can live without them. And I said, I read his book and I said, let me try it for 30 days. I said, nothing bad's going to happen in 30 days. And if it doesn't work, it doesn't work. Or, if I don't feel any difference, I can go back to what I'm doing. And so I started the carnivore diet in March of 2019. So now just about 2 years ago. And immediately I felt even better than I did doing low carb keto. The main thing that I noticed was truly all the inflammation left my body. I truly felt the best that I had ever felt in my life. And I've continued it now for 2 years. I've lost even more weight. More importantly, I've really come to realize the importance of metabolic health. I don't really, emphasize the weight so much anymore, but I talk about metabolic health and knowing what that is and measuring it and figuring out how to improve it. So, with that, I've started a telemedicine practice to help other people learn about this and to help them overcome their struggles with poor metabolic health. And I've come to realize how important metabolic health is to our overall health and how it's at the root of most chronic disease. And more importantly, I've come to realize the importance of what we eat in our health. And so that's where I'm at now.
Wow. So that's really amazing, and an amazing story to tell. So what do you like most about the carnivore diet?
So, in the end, what I like most about the carnivore diet is it's simple. I really don't have to think about food much anymore. And I know a lot of people who, aren't familiar with the diet, when they first hear about it, they say it's so restrictive. How can you do that? And my answer is it's so freeing. It's so simple. I spend so much less energy now thinking about food, preparing food, shopping for food. It's easy. It's low stress. I'm hungry less often naturally because of the diet, because you're eating such nutrient dense food. You're hungry less often. So, if I'm stuck in the operating room or it's a busy day at work and I'm, can't get something to eat, it's like no big deal. I just go, I fast a little longer. And when I, do get, home at the end of the day or when I'm, it's time to eat, it's real simple, grab something out of the fridge or the freezer, throw it in a pan or the oven or the grill for a few minutes and eat, and minimal cleanup. And like I said, the shopping is easy. I don't have to plan. I'm not counting anything. I'm not counting calories. I'm not counting macros. I'm not worried about, how much of, this or that. It just, real simple. And that's what I like most about it. And the second thing is, of course, how it makes me feel. And that's what keeps me, sticking to it.
Yeah, that is really great. And, exactly the same reasons why I love it. It's so simple and the food is great. I'm never having to, sort of leave the table hungry. It's all the food I like best. And yeah, it's very satisfying. So I agree.
Yeah, and what I tell my, what I do personally and what I tell my patients is, eat when you're hungry, eat until you're full. And, you really don't have to think about it much more than that.
Yeah, that's great. So let me dive right into like my questions for you.
Sure.
So, um, so how do you prescribe carnivore to your patients? Like, and what's their response? Like, are they like, is this a joke or are you serious?
Well, so one important concept is that, I don't prescribe a diet to anyone. I try and educate them. I try and explain to them, what has got them to the point that they're, are no longer healthy. The ones that are coming, the ones that have come to me because of heart disease, I try to explain to them what has got them to this point. I try to get them to realize that food is an important part of that, and what we eat is an important part of that. And then I just explain to them, what I've come to learn. I say, listen, I know what you've heard your entire life. I know what the standard teaching is, but you've been following that, and look at where you are and look at the results you've gotten. And I have learned a different idea around that. And, this is where it is. This is what it is. And I can tell you it has worked well for me personally, and it has worked well for many people that I have worked with. So, if you're open to considering it, we'll teach you about it, we'll talk about it, and then we'll figure out if it's the right thing for you. Because another important concept is, I don't believe that the carnivore diet is the only way to be healthy. I don't believe that the carnivore diet is, the only diet that everyone should do. I know it's worked for me. I know it's worked for many people. I think it is a good framework to build upon for many reasons that I'm sure we'll get into. But I don't just sit there and say, the only way to be healthy is to do a carnivore diet. And if you're not going to do a carnivore diet, I'm not going to work with you, because honestly, that's not the right approach. Everyone needs to find what works for them. I think it's just important to be able to educate people as to, these are the reasons, this is sort of the science behind it. And then everyone has to find what works best for them.
So what is a carnivore diet? I mean, how would you define it? I eat like meat, fat, salt, water, and eggs, but no dairy, no spices, no coffee. But, other people do include those things. So where do you define the line, or are you flexible about it?
Yeah, so I basically describe the diet as a real whole food diet, drawing the vast majority of that food from the animal kingdom. So I personally include both, meats and seafood. I'm lucky to live in Florida, and we have plenty of fresh seafood, and I incorporate plenty of that into my diet. I tell them eggs, I think are a very good food to include in that diet. I tell them that dairy is optional. Some people do fine with it and, want to include it. Other people, it's one of the trigger foods that, needs to be eliminated, at least for a period of time. And that's something else that I talk to people about. I say, just because we're starting this way doesn't mean we're going to end this way. And if we start a certain way and it's not quite working for you, some of the things that you can play with are, whether or not you include dairy, whether or not you include spices, how much fat you include. You can do sort of high fat carnivore and low fat carnivore. So those are, a couple of, things to play around with. But I tell them carnivore in its essence is a framework to work within. In its most basic form, it's a great elimination diet, and you can do it for a while. You can see how good you can feel. And then if you want to, you can start adding in, some other things, but you do that mindfully. You pay attention to how you feel, how that food makes you feel. And if something is not, agreeing with you, if you don't continue to feel as good as you've been feeling on pure carnivore, then that's probably, a food that you shouldn't be eating.
Yeah, that's really helpful to hear. I find that people want to, they want to know before they give up this stuff whether it's going to make a difference. And sometimes you just can't know. You just have to test it. And
Yeah.
I wasn't having a problem with dairy. Like, it didn't upset my stomach or anything like that. I could eat cheese. But when I took out all dairy, my asthma went away. And at the time that I did that, my asthma was like the worst that it ever had been. So it was a dramatic, dramatic difference. And, I was definitely bummed, but it's nice to be able to breathe.
Yeah, definitely. And again, depending on what kind of problems you're coming into it with, what, sort of the state of the inflammation in your body and your gut health and all of that, it might vary a lot. And I know, I know of people who, had to eliminate dairy because of certain reasons, and then after a period of time were able to reintroduce it. I think the carnivore diet, one of the great things it does is it settles down all the inflammation, the gut inflammation, the leaky gut issues. And oftentimes after that all heals and improves, then some of these foods that we weren't able to tolerate we can now better tolerate, because the gut itself is healed and that leaky gut has resolved. And so those proteins and whatever else, might be in the dairy or even certain vegetables that were, getting across the leaky gut barrier and triggering these things, might not do that anymore. So ultimately, we're all our own experiment. And that's another thing I talk to patients about. I tell them, I don't know what's going to be right for you, but let's start figuring it out in a, kind of scientific way, and we'll get you there.
Yeah. Well, I've thought about whether I want to test dairy again, but I haven't picked up my inhaler in 2.5 years, and I'm kind of like, I don't know if I want to do that, especially, given the times now, having low inflammation is ideal.
Yeah. And that's a powerful, kind of feedback thing. So if it's working for you, and, the other thing is, as you've probably experienced, people don't end up missing these foods that they think, they're going to miss as much as they do. A lot of this is just our habits. Some of it is flat out addiction when you're talking about like sugar. And once those are out of your system for a period of time, and you've started eating other things, and you're, feeling great and you're happy with what you eat, you discover that you don't miss these things as much as you thought you were going to miss them.
Yeah, absolutely. So I wanted to go back to one of the things you said earlier. You said that when you were hearing about carnivore and thinking about trying it, you were wondering what difference could this little bit of vegetables make? So what difference does it make? Why does it make a difference?
So again, I think, this is going to be different for everyone. For me, the difference it made, like I said, was the inflammation. And for me, that manifested with plantar fasciitis. So for, a couple of years, one of the things that happened when I started getting healthy was I started getting more active. I started running. I was able to train for and complete a half marathon. And somewhere along the way, thank you. And, somewhere along the way, I developed this plantar fasciitis, and I just could not get rid of it. My right foot, every morning I got out of bed, I put my foot down on the ground, it would hurt. I would kind of hobble around for like 15 minutes, half an hour, and then it usually settled down, and it was tolerable throughout the day. But it was something I noticed, and I went through periods where I didn't run. It didn't go away. I did all the exercises. I spoke to physical therapists that I worked with and did everything, and I just couldn't get rid of it. And my third day on the carnivore diet, I got out of bed, I put my foot down, and my foot didn't hurt, and it didn't come back again. Early on, when I was doing carnivore, and I went off carnivore a little bit, I had something, maybe with some sugar in it or whatever it was, I would start to notice some pain in my right foot. It was like a really great feedback thing, because it told me, you don't need, shouldn't eat that anymore. And so for me, that's what it was. For a lot of people, it's the gut inflammation and the bloating and the, a lot of these things that we just accept as normal aging anymore turns out not to be normal aging. The pains in the joints, the tiredness, the bloating, the mental fog. These are all things that once you do something like the carnivore diet and address your underlying metabolic health, and you discover, how good you actually can feel, and you can get older without getting sicker and without needing medications. It's really, eye-opening, but it's also really distressing to me that it's such like a strange concept to people. It really distresses me, as a physician and as a person, that people don't expect to be healthy anymore. They think it's normal to be on multiple medications as they get older. They think it's normal to spend the last half to third of your life, kind of debilitated and maybe in a, some sort of nursing home or assisted living facility, having memory problems. All of these things, I believe, very largely the majority of them can be tied to poor metabolic health, and they are not part of normal aging. I think if we ate better food, we would stay healthier a lot longer and ultimately probably live a lot longer. But, to be honest, we don't have the data to prove that. But I think, we can certainly be healthier a lot longer, and people should expect that.
Well, that's what I'm going for. I'm going to be 50 this year, and I am planning on living another 50 years and hopefully dropping dead peacefully in my sleep.
Yeah, there's a great quote that basically, my goal is to die young as late as possible.
Yeah, exactly. Exactly. So, a question that I get often, or a comment I get from people is that, they're doing carnivore, they're really enjoying it, but their family thinks that they're going to drop dead of a heart attack, and, it's just, really pushing them to quit. So what do you say to those families? How do you explain why this is a viable and a reasonable approach?
Yeah, so obviously as a cardiac surgeon who is, on the carnivore diet, this is something that I deal with quite often, and this is usually the number one question that comes up. So the whole fear, I guess I'll say, around the carnivore diet and heart health is based on the fact that it's based on what I'll call the misconception that eating saturated fat is what leads to heart disease. And that theory, which is really what it was basically first pushed out in the 1950s and 1960s by a scientist by the name of Ancel Keys. We now know in retrospect that the data that he based that on was either, depending on how you want to interpret things, fraudulent or just significantly misinterpreted. And what happened was, during the 1950s and 1960s, there was a rapid increase in heart disease, an alarming increase in heart disease in this country. And for various reasons, Ancel Keys became a very influential figure in this. And his theory was that saturated fat, dietary saturated fat, caused heart disease. And he pushed that narrative to the extent that there were studies that his team actually did that didn't agree with that theory, that he just ignored and suppressed the data from. There were other scientists and doctors and physicians at the time that were trying to push other theories, namely that sugar and carbohydrates were the main cause of heart disease. And basically, he just would ruin their careers, and then what happened was, so we got to a point where they issued the first set of US dietary guidelines based on this same flawed thinking. And they said, we got to lower the amount of saturated fat in foods. And the natural consequence of whenever you take fat out of food is you pretty much have to substitute in carbohydrates, because it's not easy to add protein, and basically carbohydrates and fat are what make food tasty. So they took out the fat, they added a bunch of carbohydrates, and in the in the zeal to go low fat, we ended up unintentionally going high carbohydrate. And you look at what has happened to our health as a nation since then, and the evidence speaks for itself. Obesity has continued to skyrocket. Diabetes has continued to skyrocket. Heart disease has continued to skyrocket. And people will push back on that a little bit to me and say, but wait, less people actually die of heart disease today than they did 30 years ago. And I say, well, we've gotten better at treating heart disease. We have advanced heart surgery now. We have some of these medicines, and we can keep people alive longer, but more people get heart disease, today than they did 40 years ago. And heart disease consistently for the past 40 years has been the #1 killer in this country. Everyone is so focused on the COVID epidemic and, how bad COVID is. And the reality is that last year, 2020, heart disease killed twice as many people as COVID did. And heart disease has done that every year for the past 35 years, at least 40 years, probably even more. So heart disease remains our #1 problem. And I think the simplest evidence I try and talk to people about is we've been trying this low-fat experiment, this low-fat fad diet, which is what it is, because humans did not eat this prior to 40 or 50 years ago, and the experiment is failing miserably. In the end, I think that cholesterol is part of the process that ultimately leads to heart disease, but I don't think it is the inciting event. And therefore, trying to treat heart disease by lowering the cholesterol is the wrong approach. We need to step back. We need to get to the root cause, which is poor metabolic health and the inflammation that comes along with it. And then it turns out, when you really look at the data well, if you are metabolically healthy, and one of the best pieces of evidence for that is if you look at your cholesterol numbers and your HDL cholesterol, which is traditionally called your good cholesterol, is high, and the triglycerides, which are another number on your cholesterol panel that oftentimes people don't even look at, but if that's low and your HDL cholesterol is high, the data actually shows that having a low LDL cholesterol, the bad cholesterol, is not beneficial and may actually be harmful. There's some data that suggest in that setting, in that context, high LDL cholesterol actually leads to a longer lifespan.
So, that's interesting. I had I was seeing my doctor, and my numbers came back at the time. I had 43, my triglycerides were 43, my LDL was 100, and my LDL was, I think, 160 maybe. So overall it was high, and my doctor was kind of like, I don't really know what to say. I'm supposed to tell you to get a statin, but you're very healthy, you've lost all this weight, so it's up to you.
Yeah, and actually your doctor was fortunately better than most, because unfortunately the way that doctors have been trained is to only look at that LDL cholesterol number or the total cholesterol number, and if it's high, the only thing they've been trained to do is a statin. And again, diet doesn't get into the equation, even though the guidelines actually say the first line for treatment of high cholesterol is supposed to be lifestyle modification, which includes dietary therapy. But again, the only dietary therapy that most, I would say is espoused by the mainstream, kind of medical teaching is restrict your calories and eat a low-fat diet. And the reality is that doesn't work. So, most doctors now just skip over that step in the guidelines and they go right to medications because that's the only tool they have available to them. Fortunately, there are now a growing number of physicians, other healthcare professionals. Quite honestly, a lot of this has been figured out by non-healthcare professionals. I have learned about heart disease from engineers like Ivor Cummins, from
Yeah.
computer scientists like David Feldman. And they have actually ended up teaching me about heart disease. And that was one of the other things that was a little upsetting to me, to think back and say, I'm a cardiac surgeon, and I went through medical school. I was in the medical system, and then it took an engineer and a computer scientist to teach me about what was really causing heart disease.
Yeah. But it's been beautiful the way that some of these questions have been democratized in a sense,
Yeah, no,
and I
I
think it's
think
important to have like other disciplines, chiming in, because that helps broaden the way we look at things. So
I
yeah.
think that's exactly it. And I think, first and foremost, I think the most important job of a physician is to remain curious. And if you are seeing a physician and they are not curious enough, like you come to them and say, I've lost all this weight, I'm feeling great. Yes, this one number has gone up, but all my other numbers look better. And you tell them how you did it, and you get the standard answer of, oh, that's going to kill you. Uh, and they're not curious enough to look into that, then, unfortunately, sometimes the only answer is to find another physician. But, you can try and educate them. You can say, oh, well, you can say lots of things. You could say there's this guy, David Feldman, and his website that, talks all about cholesterol. Or you can say, hey, there's this heart surgeon I heard talk, Dr. Ovadia, who goes into
Yeah.
some of this. Maybe you'll listen to him because at least he's another doctor. But overall, I think one of the biggest, issues we have in medicine is that doctors just aren't curious anymore. And it's not the doctor's fault. It's the way the system is set up. The system has been, has evolved to a point that doctors are overwhelmed. They don't have the time that they should to spend with the patients because of the insurance regulations, and the pharmaceutical industry has too much influence. The food industry has too much influence, and the sanctity of the patient-physician relationship, has been destroyed. And, besides my passion about metabolic health, one of my other passions is trying to take back control of medicine. Patients and physicians working together to take back control of medicine.
That's awesome. Well, so that kind of leads me to my next question. Well, one, how does a patient advocate for themselves in this situation? Especially if they have a doctor that's pressuring them to take statins or something like that. And two, is it dangerous to take statins while doing a low carb or a carnivore diet? My understanding is that cholesterol is sort of like a vehicle to carry fats around to the body. So if you are in ketosis and you're burning fat for energy and you're taking a statin, which is reducing your cholesterol, does that mean you're going to have an energy crisis where you're not able to get enough fat around the body?
So, I haven't seen any actual evidence of that. The triglycerides are sort of, more of the, shuttling agent, and you don't lower those with statins. So, I don't necessarily tell people it's dangerous to take a statin if you're doing carnivore, if you're doing keto. It might not be ideal because the long-term effects of being on these statin medications, I think, have been a little bit ignored or suppressed. Most of the studies that are done, and this is true of most medications, the studies to get these medications approved are relatively short studies, 2 years, 4 years, maybe out to 5 years. But we're talking about people who now in their 30s and 40s get put on these medications, and so they might be on it for 30 years, 40 years, 50 years, and we don't know what happens then. There is some concerning data that it statins may raise the risk of diabetes long term. Type 2 diabetes seems to be more common in people taking statins. Again, that data isn't definitive. There are some confounding factors there, but that's a concern. There's also some concern that it may lead to Alzheimer's or may lead to a higher risk of Alzheimer's disease. One thing we do know is, for instance, statins will cause more calcification in the heart. So,
that seems bad.
That seems probably not good. So, there is a test, and this is something else we can get into, as to what you can do with your physician if you don't want to take the statin and your LDL cholesterol is high. There's a test called the coronary artery calcium scan. It's a type of CAT scan. It's a simple, quick, non-invasive scan. Literally takes 5 minutes. You don't have to have an IV put in. Most places, insurance usually won't cover it, but a lot of places you can get it done for $100 or $150, and it will actually show you whether you have any calcium, any hardening of the arteries in your heart. So if your cholesterol is high and you don't want to take a statin, or you're kind of, not at high risk for heart disease to start with, you don't have a strong family history, you don't smoke, you don't have other risk factors, it's actually in the guidelines that one of the options is to get a CAC scan. And if your CAC score, you end up getting a score that's either going to be 0, meaning you have no calcium, it's going to be 1 to 100, which is kind of lowish for most people, or it's going to be over 100, which is, usually about the concerning range. And some of it depends on your age. But if you get that score done and it's 0, there's very little reason that you would start a statin medication, because your risk of developing heart disease over the following 10 years, if you have a score of 0, is like less than 2%. So there's no real reason to think that a medication is going to help that. But
so if it's in the guidelines, why would insurance companies not cover that?
Well, so this was only recently added to the guidelines. Physicians don't, a lot of physicians don't even realize it's in there. And the way the guidelines were written, it was basically written in as an option, but not a mandatory sort of part of the guidelines. So sometimes the insurance companies will balk at it because of that.
Right.
But one of the things we have done is we've done studies measuring CAC scans on people who are on statins. And these were done with the hope of showing that, the statins would stop the progression or maybe even reverse the heart disease. And what those studies ended up showing was it made the calcification worse in people who were on statins versus people who weren't on statins. So that's a little bit of a...
Wait, that's pretty big information. Why is that not out there?
Well, that's a very good question. I think that's a little bit of an inconvenient truth. That may be one of the reasons why CAC scans aren't used so much, because they would kind of, destroy that narrative a little bit. And then there's even,
I'm sorry, was that just one study, or was it was it a good study? Like, is that real data that we should be concerned about?
There's at least one good study that shows that, I'll say. And, the way that information was framed was that causing the calcification was actually a good thing, because it was thought that you were making the plaque harder, and that then therefore that plaque would be less likely to what we call rupture. So one of the things, that causes heart attacks is, you can kind of build up, you can kind of picture that the cholesterol and the other stuff is building up in the vessel, blood vessel wall. And at some point, a piece of that could basically kind of break off and cause a flap, and a bunch of platelets and blood clotting factors come on top of that. And then it just blocks off the artery all of a sudden. And that's one of the things that's thought to cause kind of acute heart attacks. People sometimes don't realize that there are two types of heart attacks, essentially, or two types of heart disease. There's the real acute, like someone is just, doing fine and, normal day-to-day life. And then all of a sudden, they have the massive chest pain, the massive heart attack, and they can, either drop dead, or if they're fortunate enough to, get medical care quickly enough, they can be saved with a stent or surgery. And then there's this sort of slow buildup over time. And that's when people are getting kind of chest pains and shortness of breath, over a number of weeks, sometimes months, sometimes years. And then we discover that they have kind of partial blockages of the arteries as opposed to a complete sudden blockage. And the body actually can deal with that better.
So the plaque buildup is stronger with the statins, and this study showed. And so the conclusion from the study was that this was stronger, better plaque. So
that was basically it, that there was more calcium, so the plaques were more stable and were less likely to rupture and cause an acute heart attack.
You question that.
I would question that. Me and many other doctors question that, but that's sort of the other side of the story, the other narrative that goes with that.
All right, good to know. So, so for the people who are worried about cholesterol and deciding whether to take statins, you would present this data and say,
yeah, again, so, like I said with diet, I don't force patients to do anything. I present them with information and we decide together what's going to be best for them. But the most important thing is, for people in this audience who run into this, if you go to your doctor and they say your LDL cholesterol is high and I want to put you on a statin, you should push them a little bit and say, what are my other cholesterol numbers? What's my HDL cholesterol number? What's my triglyceride number? And therefore, what is the context of the, high LDL cholesterol? There's even more advanced testing that can be done. We can do blood tests that break down the different sizes and different types of the cholesterol even further. And that can give you some more indication about how much risk you may or may not be at for heart disease.
I was going to ask about the fluffy stuff. So what is that? Can you define it?
Sure. So there's a way to basically look at the LDL, low density lipoprotein cholesterol, is actually a fairly broad category. And there are lots of different sizes of cholesterol particles that you can do an advanced test and you can actually map out the sizes of your cholesterol particles. And generally, we put them into two categories. There's what's called the small, dense LDL cholesterol and the kind of large, fluffy or buoyant, sometimes it's called. And basically, the large fluffy doesn't seem to be dangerous, doesn't seem to correlate with having more heart disease. The small dense does. And sometimes this is reported as being either pattern A or pattern B, or sometimes it's just an average size, but that can be tested and that can give you another indication. So if you have a lot of LDL cholesterol, but it's mostly large fluffy cholesterol, probably not at high risk for heart disease.
Is that an extra test that has to be done, or will that just come out? Oh, okay. So you have to ask for that.
Yeah, you have to ask for that. It's not part of the standard cholesterol panel. The standard cholesterol panel just basically counts the amount of these that are in the blood. It doesn't break it down further. So this is specialized testing. A lot of physicians might not even be aware of it or not really know how to interpret it. You might have to kind of seek out, more of a specialist. And then again, the CAC scan can be useful. Other measures of metabolic health, like a fasting insulin level, like your hemoglobin A1C and your blood sugar levels, all of these need to, be put into context instead of just focusing on the one number of your LDL cholesterol.
Mm-hmm.
And so that's what I tell people. And then also, examine and look at the other things. What other risk factors for heart disease might you have? Do you have a strong family history of heart disease? Do you smoke? Things like that also need to play into the equation ultimately about should a patient take a statin or not take a statin. But again, the unfortunate thing is doctors oftentimes don't get to that detail. And doctors sometimes aren't really allowed to get to that detail because there are sort of quality measures that doctors get graded on. And all those quality measures look at are what is the patient's LDL cholesterol number and is that patient on a statin? And they don't go into the detail. So, again, that oftentimes leads physicians not to go into that detail.
Yeah. Okay. Um, and I had heard that eating dairy can make your LDL particles less buoyant or less fluffy. Is that something you've heard, or does
So,
that make a difference?
there has been a lot of conflicting data around dairy and heart disease. There has been a lot of conflicting data around eggs and heart disease. People probably realize when they think back over the past few years, one day the news says eggs are great, eat them. The next day the news is, eggs are killing you. A couple of weeks ago, there was another study that came out that said, I think eating half an egg a day raised your risk of death by like 7%, which means I should pretty much be dead already because, I probably go through a dozen eggs a week at least. So the problem with a lot of our understanding of nutrition is the studies just aren't done that well. The studies are hard to do. So the way that most of these studies are done is they get a large group of people together and they send them out a survey and they say, what did you eat? How many times did you eat this food over the past year? And, I know me personally, and I would say most people can't remember what they ate, a week ago, 2 weeks ago. Maybe it's a little easier for me because usually the answer is steak, but, most people can't accurately recall what they ate over the past month or the past year or so. And then even more, difficult is the foods get lumped into very broad categories. So, when we look at eggs and people report that they eat eggs this many times a week, well, for me, eating an egg means, cooking that egg in a healthy fat, not in vegetable or seed oil. Maybe I have a little bit of bacon with it, let's say. Whereas for a lot of people, eating an egg means that the eggs are cooked in vegetable and seed oils, and they're having potatoes or hash browns with it, and they're having a glass of orange juice with it, and they're having a piece of toast with it, or two pieces of toast, or three pieces of toast. And these are all things that, might also be harmful to them. But when the people look at this, the people then run all the data and say, okay, these people that ate eggs got heart disease more. Now how do you know that it's the egg versus the toast and the orange juice and the vegetable and seed oils? And we really don't have good ways of, separating that out for most things. So that's the problem with most nutritional studies. And when you hear almost any nutritional study reported on the news, it's usually going to be that type of study. So you have to kind of take it, with a grain of salt, what the results really mean.
Mm-hmm. So I can eat eggs.
Eggs are great to eat. I think eggs are one of the most nutritious foods on this planet, and I highly encourage them, as part of a healthy diet, as part of a heart healthy diet.
Cool. Oh, that's good to hear. So my next question is, what is the connection between insulin resistance and diabetes and cardiovascular disease, or is there a connection?
Yes, there's a very strong connection. So insulin resistance, just to take a step back, basically means that your body is not responding to insulin, which is a hormone. And so in order to get the desired effects from insulin, which is basically to lower your blood sugar, your body starts making more and more insulin because the cells aren't responding to it properly. Over time, your body may reach a point where it can no longer make enough insulin to get your blood sugar down. And that's when we become diabetic. We know, I don't think anyone would argue with the data that having diabetes increases your risk of heart disease. Doesn't matter what your cholesterol is, doesn't matter what else you look at. Having diabetes, type 2 diabetes is what we're really talking about in this context, in your risk of heart disease.
So I just want to underscore that for everybody listening, because I don't know that I've really heard it, presented that way. So diabetes increases your risk of heart disease.
Yes. What we also know, the flip side of that, I guess I'll say, is that, there are many patients who develop heart disease who are not overtly diagnosed with being diabetic. That may mean a couple of things, but it may just mean they haven't progressed far enough, or it may mean that, people aren't looking at the right test. But when you go back and you look at insulin levels, and this study has been done, people with heart disease overwhelmingly have increased insulin levels or evidence of insulin resistance. So again, this is sort of a progression, and depending on when you look at that person, you might just see high insulin level with still a normal blood sugar level because, you're insulin resistant at that point, but you're not so insulin resistant that the body can't keep up with the insulin production. And then you get to a point where now you have a high insulin level and you have a high sugar level because the body is no longer responding to that insulin. And then there's even a final point where the body just can't make insulin anymore and it, really starts to crash. We don't check insulin levels on patients routinely. It is not a test that, most physicians are going to order for people. We only check the blood sugar level. And then we test something called hemoglobin A1C, which gives us a 3-month average of the blood sugar level, essentially. So when that patient who ultimately develops heart disease 10 years prior is at their physician and their blood glucose level is fine, and the physician said, "You're fine," the reality is that they may have a very high insulin level and already be insulin resistant, but we don't detect that. And again, we have data that shows that the insulin level probably starts going up 10 years prior to the development of diabetes. So that's the link between insulin resistance, diabetes, heart disease. The other thing that I think, plays into it is that insulin resistance either directly causes inflammation, or maybe it's better to say the things that cause insulin resistance also cause inflammation in the body, and that inflammation damages the blood vessels. And I think that's truly the start of the process that then leads to heart disease.
So are you saying that insulin resistance and the inflammation it causes is what causes heart disease?
I think it is essentially the root cause of heart disease. I think it is a much better, I guess the way I'll put it is I end up operating on a lot of patients that have a normal cholesterol level, a low cholesterol level. Some of those are because they're on medication. Some of those are just naturally they have a low cholesterol level because of what they're eating or whatever it is, but I still end up operating on them. It is very rare that I end up operating on a patient that is not either overtly diabetic or insulin resistant, when you test for it. And again, now that I know, I usually look for it. And if the patient's not overtly diabetic, I'll check an insulin level on them. But we actually have studies, prior to the development of the statin medications and our focus on lowering cholesterol. One of the prevailing theories, as I said, was that sugar and insulin resistance is what led to heart disease. So they did a lot of these studies. And for instance, one study showed that if you look at all the patients coming in with heart attacks, over 90% of them are insulin resistant.
Wow, that's pretty stunning. So, when did heart disease start to rise? Was that in the 60s? And what happened then? I mean, their diet didn't seem as bad then as ours is now, or was it still worse than still more sugar than had been in the diet in the generation prior?
Yeah, so it's the rate of heart disease started going up about in the 1940s, and then it really started to accelerate through the 1950s and the 1960s. It came to the public forefront basically when President Eisenhower had a heart attack, while he was president, and that's ultimately what led to the, ultimately led us to the U.S. dietary guidelines. But, around the 1940s is when most people, start noticing, is when you start to see a rise in heart disease in this country. There were two things that were happening at that time with what we eat. One was the amount of sugar and processed carbohydrates was going up, and the other was the introduction of vegetable and seed oils in large quantities into the American diet. And so, there's no good way to, go back and figure out which of those two things was the problem. I think they're both a problem. I think the combination of the two is what is the biggest problem. There's lots of reasons to believe sort of on a biochemical level that the vegetable and seed oils may be the primary thing that damages our metabolism. The vegetable and seed oils.
Really, over sugar?
Even over sugar. But again, it's really hard to separate the two because in our modern food environment, almost, every packaged processed food product contains both of those things. Contains sugar in some form, and it contains, vegetable and seed oils in some form. So it's very hard to separate out the two. But when you actually look at, on the level of our biochemistry, there is evidence that these vegetable and seed oils and the breakdown products of them get into the cellular machinery, our mitochondria, they're called. They're sort of the power packs of the cells, and interfere with their normal functioning. And that, likely is what causes, starts the cascade of metabolic disease. And then once you're metabolically diseased and your mitochondria aren't working properly, and then you start eating excessive sugar and processed carbohydrates on top of that, your body can't handle it anymore.
Wow. Okay. So I want to come back to the seed oils, but I want to ask this question then: is diabetes considered a risk factor for or insulin resistance a risk factor for cardiovascular disease? Like when you go to the doctor and they say, okay, you have prediabetes and you're on your way, and the end, outcome could also be cardiovascular disease.
Yes. Yeah, like I said,
Okay.
cardiovascular disease, heart disease, stroke, all of these things are significantly increased in patients that are diabetic. And many of the patients, again, the problem is that we usually don't detect the insulin resistance early enough. So, even the patients that come to me, for instance, for heart surgery, and they say, well, I'm not diabetic. And I say, well, if we look closely at your numbers and we measure the right things, I can tell you that you're at least insulin resistant. If not, some of them are frankly diabetic and it just hasn't been detected before that point.
That's that's concerning. So, wow, being insulin resistant is a big deal.
Yes, I believe that, insulin resistance, which is basically synonymous with poor metabolic health, is at the root cause of most of the chronic disease that we see in this country. So that includes heart disease, that includes diabetes, that includes obesity, that includes Alzheimer's disease, which many physicians refer to as type 3 diabetes or diabetes of the brain. Many types of cancer appear to have their roots in metabolic disease and insulin resistance. And I think if we focused more on metabolic health and insulin resistance, we would go a long way towards improving people's overall health.
Yeah. Okay. Well, let's go back to the seed oil for a second.
Sure.
And you can tell me more about which seed oils are a problem or which are not, because I often get people asking me, so how do I cook steak? Can I use olive oil? And and I'm just like, no. But why? Why should they not use olive oil or canola oil or Crisco or whatever?
So all of the processed oils, vegetable oil, seed oil, sunflower oil, safflower oil, peanut oil, are much higher in omega-6 polyunsaturated fats. And like I said, the breakdown products of those in our bodies directly have been shown to directly damage the mitochondria. So all of those, I believe, are not.
And damaged mitochondria is a problem because
that it then leads to the metabolic disease, the insulin resistance and the poor metabolic health. So I don't believe vegetable and seed oils are healthy for anyone to consume. Olive oil, avocado oil, coconut oil are, probably the three most common, they're really called fruit oils, I guess we'll group them as. They are not as high in polyunsaturated fat, in this omega-6 polyunsaturated fat. They tend to have more what's called monounsaturated fat. And then you look at the animal fats, butter, lard, tallow, they tend to be highest in saturated fat, a little bit of monounsaturated, and then, very little polyunsaturated, although that can vary a little bit. So the other problem with these polyunsaturated fats is that they're unstable, and they can get what we call oxidized, which means oxygen bonds with them and basically, damages them. That's why, the vegetable oil in your cabinet, will go rancid after a while. Olive oil will go rancid after a while. Whereas, butter really doesn't go rancid. Many people used to and still do leave it out at room temperature, and it's just fine. The problem with most of the olive oil and the avocado oil that we get in the United States is that it's not pure olive oil and avocado oil, and that the food companies, the vegetable and seed oils, are a lot cheaper to make. Olive oil is expensive and time consuming to make well. And so what a lot of the food companies
all those
do,
ladies walking around on olives.
exactly.
Yeah, it's expensive.
Exactly. But yeah, and it's hard to, so in order to bring the cost of olive oil down, most of the olive oil that you get in this country is actually cut with seed and vegetable oils. And that's why I tell people to avoid olive oil. If you can find good, pure olive oil, I have no problems with people, cooking with and eating olive oil. There's
Well,
also a
how
little
would you
bit,
know if you got good, pure
that's
olive
the,
oil?
and that's the difficult part.
Yeah.
That you gotta source it very well. You gotta look into it. If it's I guess the easiest thing I tell people is if it costs a lot less than you think, than good olive oil does, then it's
Mhm.
probably not pure olive oil. And you just got to source it very well. And that's why I personally avoid olive oil for the most part, because I'd rather cook with butter, lard, and tallow. There's also a little bit of a concern around heating olive oil because it has, kind of a lower smoke point and maybe gets, kind of oxidized and damaged more with high heat than the natural animal fats. So my preference for cooking your steak is either butter or tallow, or, just cook the steak. The reality is that, most steaks have some fat on them, and you put that on the grill or in the pan, and that kind of, naturally, causes a little bit of oil and fat coating there, and you don't need much. But my preference is to stick to the natural animal fats, coconut oil, which doesn't seem to have the tainting problem. And then if you can find pure avocado oil and olive oil, those are probably fine to consume as well.
Yeah. So is saturated fat just not bad for us, or is it actually good for us?
That's, I guess a little bit of a, you know, something we don't know the answer to quite yet.
Mhm.
I personally believe it's probably good for us. I think ancestrally, when you look, what our ancestors ate prior to introducing, these vegetable and seed oils, and certainly going back, even further to, true ancestral populations, they obviously ate a lot of saturated fat because that's, pretty much all that was around. Um, when they go back and they do these kind of studies, it seems that the ratio of saturated to kind of unsaturated, so specifically, uh, the saturated fat to the polyunsaturated fat ratio in our diet was very low. It was about 1 to 1. They were kind of even. Today, that ratio is 20 to 1 in favor of the polyunsaturated fats. So I think that, that is just way out of what our bodies evolved eating. And therefore, it kind of makes sense that our bodies might not be able to run that well when you've kind of changed up, one of the fuels. So I don't think saturate, and when you look at all the science around saturated fat and you really separate out what are actually the good studies, uh, I don't think saturated fat is dangerous to us. I do think polyunsaturated fats in large amounts are dangerous to us. So you could sort of interpret that to say, you're going to end up with one or the other. So the saturated fat may be good for us in the sense that it means you're eating less polyunsaturated fat if you're eating more saturated fat. And I
Mhm.
think that saturated fat is basically what we evolved on as humans, and so that's probably what our body is more meant to run on.
Mhm.
But we don't
And
have like that
uh
good, there isn't a single study that's ever looked at it, well enough. Interestingly, this is a little bit of, going back to the history of how we got here. Ansel Keys's team did what was probably one of the best studies ever on polyunsaturated fat. And they did what was called the Minnesota coronary experiment, where they had inmates in psychiatric facilities so they could control everything they ate. And they basically constructed two diets, one that was high in saturated fat and one that was high in polyunsaturated fats with margarine and vegetable and seed oils. The only results that were publicized from that was that the patients that ate the polyunsaturated fat, their LDL, their total cholesterol level, at that time we weren't measuring LDL, but their total cholesterol level came down. And everyone said, that's great, we should all be eating more more of these vegetable and seed oils. What they didn't report was the death rate in the patients that ate the polyunsaturated fat diet was higher than the group that ate the saturated fat diet. And that data got buried, never reported until it was rediscovered about 40 years later. And they actually went back and they asked one of Ancel Keys' colleagues. Ancel Keys had already died at this point, but one of his colleagues that was on the study with him, and they said, why didn't you publish this study? And his answer was, we were disappointed by the results.
That's the opposite of what science is supposed to do.
Yes, exactly.
That's very disappointing.
Yep.
Wow. So I know I've asked you like a ton of questions, and I just have one more question.
Sure.
And if you don't mind indulging me. So with omega-3s, everyone is, people are very worried about them and always now looking for ways to increase their omega-3s, and they worry about getting grass-fed meat partly for the reason of getting meat that has more omega-3s. Mm-hmm. So, is there a minimum amount of omega-3 that we actually need? And are we getting it by default, just following a carnivore diet? I mean, I feel like by removing, most of the omega-6 or high omega-6 foods from my diet, surely I must be in line, and I don't need to, make extra effort to eat fish and, fish, salmon roe or whatever. I mean, I can eat it if I like it, but I don't need it to make extra effort to get omega-3. Would you say that's the case?
Yeah, I would say that's mostly accurate. So again, there are two parts of that equation, the omega-3 and the omega-6. And it seems to be that the ratio between the two is, where you get into the problems, not the absolute amounts. So if you want to improve that, you can reduce your omega-6 intake and you can increase your omega-3 intake. But it may be more important to reduce the omega-6 than increase the omega-3. And I think a lot of it comes down to, how are you going to get your extra omega-3? I think if you eliminate the vegetable and seed oils from your diet, that's going to go a long way. I think if you increase foods that are naturally high in omega-3, that's great. I am not so sure that it is worth it to supplement omega-3. And I say that for a couple of reasons. One is that omega-3s need to, that they're in an oil, they're usually in gel capsules, and you got to put some oil in there. And oftentimes what these supplement companies do is they put in vegetable and seed oil. So you're sort of, working against yourself there. There are a few, better, more reputable companies that don't do that. They use a pure olive oil for their omega-3. So that's probably a little better. But, honestly, I am not a big fan of supplements. I think people should get the nutrients they need from the food they eat. Except in very limited, if you're able to accurately measure, some nutrient that you can tell you're not getting from your diet for some reason, and you do targeted supplementation, that may be useful. But the reality is, stepping back even, a little bit, most of the testing that's been done around what are adequate, vitamin levels or nutrient levels were done in people who were eating a standard American diet. So there's very good reason to think that, you know, what we perceive to be the need of the level that, you know, we need to have of some of these nutrients is probably very different if you're not eating the standard American diet. A lot of the things, you know, kind of interfere with the functioning of these vitamins and hormones as part of poor metabolic health. So I'm not a big fan of supplements in the end. I think it is great to eat, you know, high omega-3 foods, such as, you know, some of the fish, and lower your omega-6 consumption as much as possible. The grass-fed beef versus grain-fed beef, you know, honestly, the difference between those two is actually relatively small in terms of omega-3 and omega-6 levels. There is a difference, but it's not as big as most people think it is. What is a bigger difference is pork, chicken, non-ruminant animals. If they are fed poor diets that are high in omega-6s, because they only have one stomach, like humans only have one stomach. If they eat a lot of high omega-6 foods, which most, you know, kind of standard raised cows and or pigs and chickens in this country are, they're going to end up with very high omega-6 levels in their fat. So that is
So I
another.
find that I get more inflamed when I eat chicken and pork.
Yeah.
Yeah. And so I finally have just decided to give them up.
Yeah, you can find better, you know, it's now people are becoming more aware of this. So there are farmers that are, you know, not feeding that stuff to their pigs and chickens. And then so you can get low omega-6 pork and chicken, but it's harder to find. And sometimes eliminating it.
I hardly ever see that. I see farmers who, you know, talk about it being, you know, their stuff being vegetarian fed as if that is a plus. But to me, it's like, oh,
yeah,
it's not a plus.
Again, you know, you're not, you know, it's not only what you eat, it's what your food eats. You know, is another kind of thing that I try and tell people, and that goes for both plants and animals, honestly. So, you know, one of the sort of concerns I have around, you know, vegetables these days is that they're oftentimes grown in soil that's been depleted of all the, you know, good minerals, and they're treated with chemicals and fertilizers. And so when you eat those vegetables, you're going to get, you know, all of that into your system. And similarly, if you're eating animals that are fed poorly, you know, that's going to be reflected in the quality of the nutrients in that meat. But, you know, thankfully, ruminant animals like cows are able, they actually can convert polyunsaturated fats to saturated fats. So even the cows that are fed, you know, the grain-based diet, and that's actually only for the last part of their life. All cows start eating grass. It's just usually the last couple of months of their life. They are going to convert at least some of that polyunsaturated fat that they're eating into saturated fat. And so it ends up, like I said, being not that much of a difference. So in the end, I tell people, eat the meat that you A, enjoy, B, can afford, and, you know, a carnivore diet in the end, even with what we may call low quality meat, is still going to be a lot healthier than the standard American diet.
So if you're eating like a very ruminant heavy diet, not much of the chicken and pork, and you're not adding omega-3, are you going to come out even where you need to be?
You're going to get, yeah, a lot closer to where you need to be, at least, you know.
Okay.
And you can get tests. You can get your omega fatty acid levels tested.
I guess I should do that.
Yeah, you can ask your physician. There's actually a home test you can order these days. I don't have any affiliation or you know, any relation to this company, but there is a company called Omega Quant, and you do a finger stick at home and you put it on a, you know, kind of test card and you mail it into them, and then they can test your levels of all the different fatty acids, and they give you an omega-6 to omega-3 ratio in your bloodstream. And or there's also, going through your doctor, you can do blood work, a blood draw, and test these levels through a number of companies. So it is something you can get tested. You can ask your physician about it, or you can find a physician that's knowledgeable about this to order it and test it for you and measure it.
Is that going to matter to your doctor? Like if you say, I don't want to take a statin, look, my omega-3 and omega-6 ratio is even. Are they going to say, oh, okay? Or are they going to say...
Unfortunately, most of them are probably going to look at you and say, what are you even talking about?
Yeah, okay.
I would say it's going to be somewhat rare that you're going to find a physician, but there are plenty of them out there. And you just have to kind of seek them out. Sometimes more of the functional medicine doctors, kind of pay more attention to those things and, the nutrients and stuff. But yeah, it is something that you can either do on your own or, find a physician who's knowledgeable about this type of stuff to go into that detail with you.
Yeah. All right. Well, thanks a lot. That was super, super helpful. Thank you for going into all that detail with me. I really appreciate it. And you've answered so many of my questions. Is there anything more you'd like to share with the Black Carnivore community? What do we need to know?
No, like I said,
how do we come to you? Can anyone in the United States, schedule with you, or do they have to live in Florida, or what's the deal?
Yeah. So, in terms of working with me, my practice is at ovadiahearthealth.com. It is a completely telemedicine practice, so I can see people remotely from anywhere. There are some limitations in the states I'm licensed in versus not licensed in, but pretty much I can see patients from anywhere. You can find me on Twitter at iFixHearts. You can find me on Instagram at Ovadia Heart Health. And now I'm actually getting pretty active on Clubhouse which is a new platform where we first met, and I'm there as iFixHearts as well. But you can go to my website, you can get all the information about signing up for my practice. My biggest messages to people is don't accept being unhealthy. Take back control of your health. Find a physician that will work with you to take back control of your health, and just realize the importance of what you eat on your health. And those are the two biggest messages I want people to understand.
Wow. Well, thank you. I really appreciate that. This has really been so helpful. Thanks again.
Thank you. I think there's been a great discussion, and I really appreciate you having me on.